Okay, David.
Yo.
Don't freak out because I'm going to ask you to talk about something that I normally would never ask you to talk about.
Oh boy, here we go.
Okay. You like all that superhero stuff, right?
Oh,
all the movies.
Yes. What kind of a nerd do you take me for?
Okay. Well, you know, I'm usually not an action movie type, but I do like a good origin story.
Oh, yeah.
Like, you know, where did they come from? Like, were they
sure.
always a superhero? No. Like, that had to happen somewhere, some way, right? So,
right.
Okay, I want you to tell me your favorite superhero origin story.
Oh, favorite? That's a stretch. And then the comment thread just might turn into a Reddit argument. So I'm going to pick what I would arguably say are three distinct origin stories. And these three work together. So in the DC universe,
they work together. They work like us.
They do. Yes.
Okay.
These superheroes work together on many missions. So we've got Batman, Superman, and Wonder Woman. They're kind of like the high level triad for DC Comics.
The OGs.
Well, kind of.
Sort of.
So the thing that makes them so different is they're just kind of normal people. So Batman, Bruce Wayne, normal guy, but his superpower is that he has almost unlimited resources and technology, and he's able to be a vigilante and buy all sorts of cool gadgets to catch bad guys, right? So Superman is not a superhero. He is an alien. And he just so happens to have superpowers because he's on our planet, and our planet's atmosphere and gravity interact differently with him than he would on his normal planet. Also, his superhero outfit, that's just his normal clothes from his home planet. Wonder Woman, she's an Amazon. She's just amazing, but like not necessarily a typical superhero that got bitten by something radioactive or had some nasty chemical spill or something and then had powers. So I'd say those three are kind of, yeah, they stick out in my mind because they're a little atypical for superhero origin stories.
Okay, pause. First of all, the fact that you know all that.
I told you, what kind of a nerd do you take me for? It's really freaking me out
right now, but it's so impressive. Well, today on the podcast, we ironically are going to have three guests who truly get the response of superheroes up at the hospital.
Oh, yeah.
And so these three ladies have three things in common. So first of all, they are all Cardinal Glennon moms.
Awesome.
So they have all had a child who has been hospitalized at Cardinal Glennon. They all sought an intentional way to give back with gratitude at the hospital. And they all three have this belief in the power of a snack combined with authentic compassion.
I think those are two very important things. Like,
for sure. We are going to have the Cardinal Glennon snack cart ladies on the podcast today. And I am so excited because they truly are highly anticipated angels just walking the hallways of Cardinal Glennon. And, you know, they're not medical savers, but they're moment savers.
I'm so excited to get to talk to them and hear about what it's like to be the person who pushes the snack cart and just brightens people's days.
Yeah, for real. So we're going to get to hear their origin stories and their backgrounds and their connections to Glennon and why they're doing what they're doing and making people's day every day.
Awesome. Let's get them in here.
Let's do it. Let's welcome our guests.
Let's get right to it.
Okay, we're going to welcome Lisa and Kenda and Claudia, who are just these amazing angels, amazing women, all Cardinal Glennon moms, all Cardinal Glennon volunteers. And specifically, your volunteer role is running the snack cart. Yes?
Yes, it is.
Yes.
That's a very important thing. How many, so from each of you here to my left, how many years have each of you been working with the snack cart at the hospital?
2.5 years.
2.5 years.
I was going to say, I don't remember. I started just before Lisa did. So maybe 3.
Oh.
I want to say 9 now.
9.
You the OG.
I think so, yeah. It was you
real.
and me.
I
You and me,
know,
Laura.
girl. Oh my God, that's been a long time. Well, we're going to talk more about the cart, but first, I really kind of want each of you to share your Glennon connection. You have all been the parent of a child hospitalized at Cardinal Glennon and have very, very, very different journeys, each of you. So we're just going to go down the line, and I want each of you to share your journey. That could be Lisa could have a whole podcast. Kenda could have a whole one. They're all very large journeys, but succinctly, if you can just kind of explain your Glennon journeys.
Well, thank you, Laura. Our journey with Glennon began on February 17th, 2010. Our daughter was having some illness issues, and I didn't feel she was getting better, and I was very concerned. So a friend of mine recommended I contact Cardinal Glennon, which I did. And Teresa put me immediately through to Dr. Megan Guerra. I talked to her for about a half hour, explained all of her symptoms and what she's been going through and what we have done so far. She ordered some tests to be done, and we did the test that afternoon. I got a call while at my son's basketball game saying we should go pick her up and bring her in immediately. And so obviously you can imagine as a parent, you're at your son's basketball game, she's at a confirmation prep meeting, and I have to go get her and take her to the hospital. So we did it very calmly, packed our bags, and she was very confused because she was, quote, feeling okay, but not okay. So we went to the hospital and met with the doctors immediately, got her in her room on 3 South, and they had more tests to do for her. And as upset and nervous and scared as we all were, especially her and me, we had to transport to SLU for some more testing. And the transport person, she could see the anguish on her face and scared. We're scared, sad. And she immediately looked at us, smiled, embraced our pain, and just talked to us very calmly and made Maggie laugh. And so that was the beginning of an amazing journey through Cardinal Glennon, that one transport person taking us from 3 South to SLU for testing. And that was with Dr. Megan Guerra, Dr. Marianne Dunstan. Those 2 doctors and the entire medical team really surrounded us with love and care and their expertise with her health situation. We were there for about a month and a half. And as you can imagine, as a parent, you have a life at home as well. I had a son at home, my husband, and so he took care of him, and we tried to get together as much as we could as a family in her room and got to be with her, and all got to experience what she was going through. So she was never alone. But also her med team was always with her, coming in and calming her down if she was nervous or scared. Child Life would bring her things to do in her room, which she thoroughly enjoyed doing, just trying to keep her mind off some things. Something for us to do in the evening, if we needed to, is to go to the Ronald McDonald House upstairs on 5, have a soda, have some downtime. I could take a shower, I could wash our clothes, whatever the case may be. It just made it even more comfortable. I didn't have to worry about those kind of things. It was just very inviting. She missed half of her 8th grade year, and she got to go to freshman year, and then half of her sophomore year, she had to go back to the hospital, some tests, and come back normal. And so that crushed her. Here she is, almost 16, 15, and so she has to leave school, leave her friends, leave her life, and go back in the hospital. You're not sure what's going to happen. I felt from our faith in God and her entire med team, again, from the transport to her doctors, her nurses, Child Life, made a huge impact on our lives and on our daughter. And she returned to school her junior year and was able to do cross country, went to state her senior year of high school. It was amazing to see her and be so proud of her. She did graduate, and she went to school, and she wanted to be a nurse. When she experienced her time here at Cardinal Glennon, the love, the care, the wellness of her future, she wanted to give back to what she received. So she went to school, and she graduated, and I'm very proud to say she is a nurse on 2 South and has been for the last 2.5 years, and loves giving back to her kiddos what she received from her team.
Wow.
That's awesome.
That's powerful.
Awesome. Okay, Miss Kenda, your turn.
Okay, I'm glad I didn't have to go as far as Lisa, because I'm like, dang, that's good. She's got a lot of good stuff to say. Shoot. It's been 11 years. In August of 2013, I took my youngest daughter, Lucy, who was almost 5 months old, to the emergency room. We just thought she had a stomach bug. weren't super concerned, but after a very scary night, we were told she has infant ALL. It's acute lymphoblastic leukemia, the infantile diagnosis. It was super scary, long night, straight to the PICU, and then straight up to 4 North. So it was a really hard treatment, a little bit different from typical ALL. We were hospitalized most of the time for a full year. And at the time, I had a 2-year-old daughter, almost 3, at home. So my husband had to stay home with her. And being a nursing mom, I stayed with Lucy on 4 North, which became our home away from home. We did everything on 4 North. We celebrated my older daughter Violet's 3rd birthday in the playroom on 4 North. First Christmas, first birthday, first Thanksgiving. We just really got to know all of the nurses and the doctors. We saw all of the doctors. We got to know them really well, and they got to know us really well. Eventually, our journey took Lucy to Seattle Children's Hospital for a clinical trial, and also Children's Mercy in Kansas City. But Cardinal Glennon's always our home. She is still followed up by the bone marrow transplant follow-up team here at Cardinal Glennon. She is 11 and doing great.
Wow, that's awesome.
Wow. And then Claudia.
Yeah. So my story is not the happy one, unfortunately. So my son, Nicodemus, was born in 2012, and we found pretty quickly that he had some kind of issues. We didn't know what it was. And so we started chasing what was going on, chasing symptoms, trying to figure out things. And it led us over the course of things and him getting ill and other various issues. We wound up in one of the children's hospitals in the area, and things happened. We were in emergency transfer. We were told about, 9 o'clock at night one night that if your son's going to make it through the night, he has to go downtown. And, we weren't even told which hospital our insurance took or whatever. So we just basically had to point and say, are you going to Children's or are you going to Glennon? And we're like, I don't know, I guess we'll go to Glennon. And so thankfully it worked out. Our insurance took it. It was definitely a miracle because we all know how that is in America today. And so we wound up going to Glennon, and I actually didn't know where the front entrance was for like the first week I was here because we came in, an ambulance roaring through the back. And so I had no concept of where the front was and went straight into the PICU and basically was there for more or less the next 3 years. We would bounce out for a little bit to TCU or 2 South and then maybe go home for a little bit and then come right back. And long story short, my son was the very first person in the world with his genetic condition. And it was a medical mystery. The test that diagnosed that genetic condition did not exist when he was born. So we were really on the cutting edge of the science with that. And unfortunately, just because they could find out what it was doesn't mean that there was anything they could do about it. And so my son died in 2015. And the people here were just fantastic. Everybody tried so hard. The doctors, the nurses, the staff were simply phenomenal. And even the folks that I didn't know as well were still supportive through that whole journey. And just some of the things that came out of it that I never expected, like the fact that I'm still friends with the young resident who was the person there the day that my son died. You wouldn't expect to stay in touch with someone like that, but it became a really deep and meaningful relationship with both of us. So it's things like that that stick with you and that give you meaning and purpose. The fact that my son saved 12 people's lives through organ and tissue donation. If a soldier on a battlefield saves 12 people, we give them all kinds of medals. My son was only 3, but he saved 12 lives. And I feel like if that is what he was here to do, that was a pretty amazing thing.
That's absolutely amazing. Thank you for for sharing your story. That all 3 of you very impactful. From a personal level, I'm very blessed. I've never stayed the night over at Cardinal Glennon. Both of my boys have been treated at Cardinal Glennon, but from an outpatient perspective. So I'd like to talk a little bit about some of the nuances for what it's like whenever your whole world gets to move in to Cardinal Glennon for sometimes an unknown length of time. Kenda, I want to start with you. So kind of specifically, What are some of the practical and uncomfortable realities you face from when you're being taken out of your home environment and you get transplanted into the hospital environment?
Like you said, it was a year. So
It was
That's
a
a long
year.
time.
you're
Yeah.
moving out and you're
That's
moving
right.
in to
That's
Cardinal
right.
Glennon. So
And we walked in with the clothes on our back. I thought we were going to do a quick visit to the emergency room and then be home in time to take my daughter to preschool, but that did not happen. I'll never forget, we started out in the emergency room and then Lucy was transferred to, and the beginning of these diagnoses are always a huge blur. So I don't remember much, but I remember she went straight to the PICU. And then it took a while for her to get stabilized. And I was finally called in to come. She was stabilized and fine, and I could spend the night in her PICU room. And it had been, I hadn't slept in like 36 hours. It was a zombie. And I will never forget the nurse was kind of going over some paperwork. And I was like, I cannot even understand a word you're saying. But I was trying to pay attention. And for some reason, it stuck with me that she said, one of the rules is you have to keep your shoes on in this room. And I was like, well, that's weird. Of course, I'm going to keep my shoes on in this room. Well, then I had weeks later, we made our way up to 4 North. And I had sort of like a mental callback to that moment. It was at that time, the rooms were not renovated. And so there was one parent shower on the whole floor. And so I'd taken a shower and I had my hair wrapped in a towel and I was just walking down the hall. And one of the nurses saw me and was like, oh, look at you. You're so cute with your hair in a towel. And I hadn't even thought about it. I'm like, I just took a shower. And then I thought back to that shoe moment. I'm like, oh my gosh, I get it. I live here now. Like, this is my home. This is where I live. And, luckily, because I was a breastfeeding mom, Cardinal Glennon offers meals for breastfeeding moms. So that was a huge advantage. And it's the first thing the nurses did when we checked in. Oh, I'm going to put you on breastfeeding mom meals so that I could call room service. And because you don't think about, I had an infant, I couldn't leave the room. Even going to the bathroom, I would hope that she would stay asleep while I was gone. Walking the hall, there was nobody to talk to. I would, a nurse would come in and I'd be like, tell me about your day. It gets really lonely and isolating, and you're kind of afraid to take time for yourself as a parent. So it's a whole new world.
I have to ask from a parent perspective, because we've gotten lots of feedback about how awesome the cafeteria is. But what has been your favorite thing that you have ever ordered as a parent from the hospital cafeteria?
Oh my gosh. I have to tell you, like, the first person, everybody at Cardinal Glennon is amazing. And every time I called for a meal, whoever answered the phone, they were incredible. I would order, I'll take a chicken sandwich or whatever. And they're like, well, you get 2 sides. Get another one. Every time they convinced me to get dessert too. And I'm like, no, get a dessert. Okay, I'll get the chocolate milkshake. The breakfast sandwiches were amazing. The bacon was always crispy. The milkshakes, the cookie, chocolate chip cookie dough, or the cookie milkshakes were amazing. Lunch, everything was so good from the room service menu. Grilled chicken sandwich. I'm set. So good.
Making me hungry.
And the ladies on the phone were great. They'd be like, get dessert. Get it. Okay.
What about you two? What do you have to add? Well, how was being at Cardinal Glennon different than being at home?
First and foremost is I remember very distinctly, I'm walking the hallways in shorts and a tank top. Again, it was one of those days we'd been there 3, 4, 5 months. I don't know. It all blurs together after a while. And I'm walking down the hallway with my giant mug looking for the ice machine, going to get some water and whatever. And I look outside and there's a blizzard. And I'm in tank top and, shorts. And I'm just like, I've been in here a while, because those are the clothes I wore when I got here. And I was just like, oh, I really have been in here a while.
It's like people who go down to spring training for for the winter and then they come back to St. Louis.
You're just like, whoa, what just happened when I was here? So that was definitely one of those moments where it just really hits you how alien an environment that you're in, because you are completely, as you said, it is so isolating. You're completely out of touch with reality, really. Like, you have no idea what's going on outside the walls.
It is very isolating, and come from you're busy with your 2 children, you're taking them to soccer, religion class, or whatever you take them to, and like, whoa, now I'm here, and now she's here with me, and we're not going anywhere. We're staying put. We're getting her healthy. I was used to working 9, 10 hours a day, and now I'm at the hospital. That was a big adjustment.
I want to explore that a little bit more, like the mental and emotional shifts that you make when you're in the hospital. Like, I think about when it was me and my kid, like it was a total loss of control. Like I was no longer on my schedule. It was everybody else's schedule.
Yeah.
And, how I would typically run my day wasn't the same. And it just made me feel a total loss of control. So dive into that for me for a minute, like the emotional and the mental shifts that were challenging.
It was tough. As a mom or a dad, you are in control of your child, and I wasn't, and I wanted to be, and I wanted to administer things, but obviously I was not able to do that. I'm not a nurse. I'm not medically fit to do those types of things, and they are. I trusted them. I think that was the biggest, I guess, easiest thing for me. I got to know them and trust them, and saw her improving, and I just had to bite my tongue and pray to God to help me get through this day. I can't do what I want to do with her. I have to let them handle her. And they did. But it was tough for a while because it was just her and I there. The visitors and stuff. But at the end of the day, I'm there with her and sleeping with her or whatnot. And I can't really do what I want to do as a mom.
What about, you mentioned work too, that you were used to working outside the home like 9 hours a day. So talk about that, because guess what? You weren't doing that anymore. So that's changes in your social circle. That's
Right.
changes in,
That was tough. I had a career job, and I was on all the time. And thank God I worked for a company that valued family and valued me, and I could work what I wanted to in the hospital. I didn't have to work, but if I wanted to, I was more than happy to do that. But I missed that part of it also. But again, I was very, very blessed not to have to worry about that.
Kenda, you mentioned, all of you actually mentioned feeling isolated, and that you walked the halls and kind of craved that social interaction. But did you feel like over time that your normal circle of friends and family really didn't get, like the people in the hospital get what you're going through?
Yeah.
Did the people in your, I'm going to say normal world,
Your
like
outside
get what
world.
you're going through? You know what I mean? Like, I feel like that's also isolating, right?
Yeah, it is. It was a really tricky but interesting time. My older daughter Violet had started a brand new school. She was just starting school, preschool, and it was just really challenging because we needed help immediately. I'd signed her up for like 3 half days of preschool, and suddenly I was like, I have to be at the hospital all the time. I had to live there with Lucy, and she had to go all day, every day. And it felt so weird that I didn't know anybody at that school. And I remember they started like a meal program, but they didn't tell me. So one day they're like, did you pick up your dinner every Friday? Somebody's leaving you dinner in this refrigerator. And I was like, I don't know what you're talking about, but I appreciate it, and it's the loss of control was that, like, we kind of felt the opposite. Like, so many people wanted to help us and so many people reached out, and it's overwhelming because I'm a person who wants to thank everybody, which is probably what led all 3 of us to this cart. And I felt like I want to tell everybody, thank you personally. You just have to put that aside and accept the help, accept that you may not know who it's coming from. You may never be able to thank them, and they have to be okay with that. And you have to be okay with that as well.
Yeah, and I think part of it too is the knowledge that people may mean very well and may say absolutely the wrong things. And sometimes it's just ignorance. They just don't know. People just don't know. What do you say? 3-year-olds aren't supposed to die. Like, that's not supposed to happen. And so those are the kinds of situations where there's nothing you can say or do to make it better. And yet we're taught that we're supposed to make things better. And so it's very difficult to be in those situations as the person going through it, of course, but also as the person trying to offer comfort or love or help. What do you say and what do you do? And so those are the situations where it's very difficult for everyone to kind of get through it. And I think even if it's not as dire as death, if it's just someone who's sick, it's very hard. What do you say when somebody's baby has cancer? How do you express, I'm so sorry for what you're going through, without cheapening it in some way, without making it, well, my kid was sick too. No, your kid had strep, which is bad, but they came home after 3 days.
Right.
That's a little different than a child who's here for a year. And so it's trying to help people understand that they can be compassionate without having to have comparisons, without having to cheapen the
Right.
compassion. And I
Right.
think that's an important skill for everybody.
I remember Sister Judy. She used to be in, remember Sister
I do.
Judy? Used to be in pastoral care. And Sister Judy would always want to have that meaningful moment with me, right? To come in and just have a conversation and catch up. But we could never, ever connect. It's like every time she wanted to come in the door, the docs were coming in for rounds, or, I was gone, or like we just never, ever were able to connect. So every once in a while, I would come back in the room and there'd be like a blueberry muffin. That was like her signature. And she'd just write a note on a paper towel. Came to see you. You weren't here. We couldn't connect again. Have a great day. And she'd
And a
leave a
blueberry
muffin and a
muffin.
blueberry muffin. And I was like, oh my God. Like it was just, it was gold. Like it meant just, I won't say it meant as much as people being vulnerable with you, but like, it was awesome. Like that would just flip the wind of my day.
For me, I think just being able to communicate with other people, their other parents on the floors too, that was important as well. I think some of the nurses could see that. You mentioned it's really about talking to people and walking around the floors, but just, talking to other families and just stepping out for half hour and just in the waiting room, just talking.
Yeah. Would it be safe to say for each of you that what you went through with your child at Glennon was probably one of the hardest things that you've ever had to deal with?
Bar none.
Yes,
Yes.
absolutely.
But you all decided to come back. And now you're being that ray of hope for other people. So why? Why? I mean, you all could have just said, peace out. It's been real, but you didn't.
For me, it's just to give back. My role model was Maggie. I mean, she's the one that she came back after everything she went through. It was just all the pain was on her, and she had overcome all of that, and she did an amazing job. But it was challenging, and she did that. I learned a lot from her, and the fact to go to college and to work as hard as she did, and come back as a nurse in the same hospital that she went through so much. I wanted. She was my inspiration to keep coming back as well.
So I'm going to ask you all that. So, okay, you all have this desire to come back to the scene, so to speak, and to give back. What did you like? Was there this automatic vision of what you envisioned yourself doing that you're like, I want to do that? Or how did you come to, I want to be in the halls. Like I want to food people. I want to do, how did that come about?
I didn't know what to do. You and I worked before many years ago in the Ambassadors Club, and I wanted to do something. I didn't care what I did. I just needed to be back here. Whether it was rocking babies, whether in the playroom, the snack cart. I just wanted to be working with you and giving back to the families and the med teams.
Yeah, same, Laura. I think you offered the snack cart, and I was like, the snack cart, yes. I would love to do that.
It's an instant win.
Yes, because I spent most of the time here, but I remember I told my husband I was going to volunteer at Cardinal Glennon, and he was like, oh, wow, is that going to be okay? Like even Lucy, does not like to come back here. That's trauma for her. It's really hard for her. And then when I talked to you about the snack cart, he doesn't remember as much, or he wasn't here as much as I was. And I said, do you remember Laura and the snack cart? And he's like, yes, I remember Laura and the snack cart. And I was like, I'm going to do that.
He liked his hostess,
Oh my gosh, the shots of candy. And I love the idea of walking around and engaging with parents, because when I saw you were the best part of my day when I saw you in the snack cart. And like I said, I got meals, so I wasn't like as hungry as the rest of the parents, but I needed a little bit of adult interaction. I mean, just talk to me for 2 minutes. That's what I wanted to do for other people, because I felt like I don't always say, and I don't usually say my experience, but I am not afraid to be there. I'm not afraid to stand in their trauma and experience whatever they're feeling. And I'm just so grateful and proud to be able to do that for other caregivers.
I hear Kenda say, I'm not afraid to lean in and be part of their trauma. And Claudia, I'm looking right at you. Because,
part of it is that this is definitely fits my training as well. This is my 27th year in ordained ministry. So I've been doing this a hot minute. So, but I think part of it is also just, it is that need to give back. The doctors and the nurses and the staff who gave me 3 years with my child that I would not have had otherwise. Would I have liked a lot more? Of course. But at the same time, that extra time was a gift. And I see it that way. I get to pray as I walk down the halls and as I see his name on the organ board, and walk past the rooms and know we're in them. One of the things that I'll tell parents, and again, I don't know if any of us do, but we don't share a lot. We're not here to tell our story to the parents. We're here to be there for them, right? But one of the things that I will tell parents when we're talking about their day, especially when I'm in the PICU, they'll be talking about how rough it is or whatever, and I'll be like, I feel it. I have slept in that bed. Because basically every room in the PICU, I'm like, I've been in your bed. I know, I feel it. I know where you're at. So please have that extra brownie. Take that extra snack. Because it does. I mean, when you're talking about the little things, Laura, that cream cheese carrot cake down that was my breakfast, lunch, and dinner. Because it was the only food I could actually eat. Because just nothing else would I just couldn't. Mm-hmm. And so, being able to be back and give back that little bit to those people, to help the doctors and the nurses, the staff members, first and foremost, know that people do care and respect what they do. Because I think so often they feel invisible, or they feel like maybe they're not as appreciated as they should be. To know that there are people who deeply care and remember the kindnesses that were shown to them. Mm-hmm. And the way that some of our custodial crew, there's some folks that I talk to every time I'm here because they were wonderful.
Yeah.
There was some of those folks that I got to know really well because they cleaned our rooms every day. And again, that was the only human interaction we have that day, so we got to be good friends. We got to know each other. And so to be able to provide those folks with some uplifting stuff, because they have a hard job. Keeping hospitals clean and sanitary is a critical and important job.
Oh, for sure.
And it's a very hard, physically demanding job. So making sure that we uplift those folks in any way we can is important. Making sure that our staff, especially the last 4 or 5 years with COVID and the incredible amount of stress that they've been under, helping them know, we're here. We're here to have your back and to say what you're doing is important and it matters. And then to the parents, to help them know that there is something on the other side of it. No matter what the end goal is, whatever the outcome is for their child, that the parents, that life does keep going on. And that people will walk with them through it, and that they will find a new way of being on the other side. And that's why I'm here, is just to kind of be that living testament of, you can get through this.
Wow. Well, and you mentioned that, our EVS staff, they are angels in the hallway, for sure. This hospital would not run without plant operations and EVS. Mm-hmm. But I am kind of curious from all of your perspectives, what is kind of the reaction whenever they see the snack cart rounding in, on their floor or in their hallway? Kind of tell us what that's like.
You can all speak to that. That's for sure. So we're going to divide this up. What's the reaction of staff?
It really depends on where you're at in the year. So early on, the younger staff, so our residents and our early fellows, are a little more hesitant because they don't want to get in trouble with their supervising staff.
For getting a snack?
For getting a snack, because they're still trying to figure out how the hospital works and how things are going and whatever. But then you get into the point where they're working their overnights and their long, 48 hours or 72-hour shifts that they do and all these long things, or you get a bad storm and they've been here for days and days or whatever. And what kind of happens, then they get towards finals and all of a sudden we are their best friends. And I don't know about y'all, but it's I just kind of put the cart out in the hallway and step back so I hold my fingers at the end of it.
We're going to have to start adding Red Bull and ramen to it or something.
Yeah, exactly. We have had ramen on the cart before.
Cup of noodles.
Yeah, exactly. So, but I think they really enjoy our presence.
The one on 2 South, she saw me coming one day and I was pretty far away and she's running down the hall. She's coming, the snack cart's coming. And that just made my day. She was hysterical.
Oh, I've seen them get on the pager.
Yes.
Like the group
Yep.
pager at the nurse's station. One of them will go, okay,
Yep.
they're here. What's your order? I'll get it for you.
And if I had $1 for the number of times that somebody has taken, a staff member has taken some off the cart going, yeah, I'm going to take this extra one for so-and-so. They're stuck in a room and this is their, meal, lunch, dinner, whatever it is.
Oh.
I mean, oftentimes we don't think about it, but if you're in a very complicated procedure, or if you're just having a very difficult day with patients, some of these folks may not get food.
Mhm.
A whole 12-hour,
Right.
14-hour shift, they may not get a chance to take a break. So that Snickers bar may be the only food that they get. So I think it's really important that we do provide that service to our families and to the staff,
Mhm.
because they're busy doing the things that they can do. As you said, we're not doctors. We're not, it's not our job. So we're going to let the medical staff do what they can do. And we're going to be behind the scenes supporting them and giving them what they need to accomplish their job.
I know. I think it's funny, Claudia. I get that same thing. They'll take something and say, this is for so-and-so. And I'm like, I don't care. Take two. I don't care if you want 2 of them. Salty and sweet.
We
Do
ain't,
it.
we ain't going to talk
Yeah.
about you.
We do not
Yeah.
judge.
Does so-and-so
No
does so-and-so
judgment.
need a third one? That's
Right.
What's the reaction of the families?
Different. Yeah. My favorite part of the snack cart is, there's certain, I'm partial to 4 North. So I knock on doors at 4 North. I know, there's no dietary restrictions. They're trying to get those kids to eat. And, I knock on the door and I say, if there's a parent, would you like a snack? And you both probably experience this every time that parent or caregiver turns to their child and says, what would you like? And I say, let's find something as long as it's okay with their nurse. But, and then I say, but this is for you. Pick something that you want. And they'll say, I'm not hungry. And I say, and I insist, this is my goal of the day, is to force them to get something. I say, well, get something for later. And then you see them say, okay. And it's because
It's like the person from food service who convinced you to get your shake.
I'm paying it forward,
Yeah,
Laura. Get
I
that
know.
shake.
I hear you. Mm-hmm,
Yeah.
mm-hmm.
Yeah. It's like the caregivers need permission to take a little time out for themselves.
Yeah.
So that it's very different. It's opposite, I would say. And also they don't know what it is. I've had people everybody tries to pay
Oh
and
my
we're
gosh,
like,
yeah.
no, this is for you. And
I think we've kind of alluded to this, but just kind of in a nutshell, what's the most rewarding part of this could be seemingly simple act that you all are doing?
again, I already said it, but I think when I force a snack on somebody who didn't originally want it,
Yeah.
just to see them take a break for themselves, or, we've all walked down the hallway and had people people will chase the snack
Mhm.
cart and say, I haven't eaten all day, because we don't round every day.
Mhm.
So when we get that, this perfect timing, when, a nurse says this is just what I needed. I'm like, yes, that made my
agree.
whole day. That was worth it.
The appreciation and thankfulness of families. I mean, they're going through, we know what they're going through and here they are smiling at us. Thank you so much. We appreciate it. I'm like, well, thank you. I mean, it warms my heart. It truly, truly does. Or a med team going through a challenging day and, oh my gosh, I really need this today. I can't get away. And those are the times that mean a lot to me.
Yeah, completely. And I feel like it's so funny because everybody's always so thankful for us. And it's like, guys, we're not the ones that are doing the hard stuff. You're doing the hard
Mhm.
work. The parents that are in the rooms, the staff doing those complicated procedures, you guys are the ones that are doing the hard stuff. We're just giving you the candy that's keeping you going. So we are giving our gratitude to you in the form of candy. You don't need to be as grateful to us, but they're always so grateful and so happy. And it's just a wonderful thing because there's never a bad time to have chocolate. So it's just one of those wonderful jobs where everybody loves you. And it's just great.
Well, I will just say the Snickers people got it right when they coined the slogan, "You're not you when you're hungry." And I really think we can all identify with that. I was not my true self when I was a parent in the hospital. And those little things do make a solid difference in shifting the wind in your day. You know, they really, really, really do. It's kind of that reflection of, whatever, the Maslow's hierarchy of needs. We got to meet people where they're at this
Right.
basic physiological level in order to expect people to meet us where we're having high level conversations about leukemia and death and one in never genetic conditions and, all that kind of stuff. And we got to just meet people where they're at. And you guys are really helping meet that, not just with the snacks, but with your hearts.
Yeah.
And, meeting people where they need at that level as well. And you three lived all that during your time. And I know you value paying it forward. And speaking from me personally, like I said, it's the little things. And there's a saying that, like I think about how badly I wanted to control the big thing, how badly I wanted the diagnosis to go away, how bad I wanted the fear to go away. And those are great things that we just don't have the magic wand to control. But we can control little things that are within our control. And there is a saying, and I don't know who made it up, but I've seen it a million times and I have it on my computer. If you cannot do great things, do small things in a great way. And I really feel like we do a lot of great things at Glennon, and we do a lot of hard things at Glennon, but we do small things really, really well too. And you guys are a huge example of that. And you are the Glennon factor. And that's why we wanted you here today. Any closing thoughts? Anything else you'd like to share?
It is an honor and privilege to work with Lauren and these lovely ladies, and to give back to a hospital who I can never think enough, and something small to give back to the med teams, the families. It's something I want to keep doing. It's a privilege to be here.
I would agree. Before Lucy was diagnosed with cancer, the medical world was not in my orbit at all, but I always believed and knew they were making a huge impact in the world. And then when we went through Lucy's diagnosis and treatment, I never thought I'd be able to give back in any significant way as, like Claudia said, a lay person, but this has given me that power, and I find it so meaningful. So thanks, Laura.
Thank you.
Yeah. I just feel like every chance to give somebody a better day than they would have had otherwise is reason enough to get up and get out of bed. So every day I can do that keeps me going, as well as hopefully those families and the staff. And for that, I'm very grateful.
Well, thank you, Snack Heart ladies.
Yes. Thank you for feeding hearts and stomachs up at the hospital. We hope you enjoyed this episode of The Glennon Factor. Make sure you follow The Glennon Factor and leave us a review wherever you get your podcasts. Visit glennon.org if you would like to learn more about how you can support Cardinal Glennon kids. And while you're there, feel free to share any feedback or episode suggestions on our podcast page. The Glennon Factor is recorded and produced by SSM Health Cardinal Glennon Children's Foundation.